As Diana pointed out, and Dan too, research was stopped in 1996. Federal funding for all research on gun violence was stopped because CDC had been told, besides not publishing what we already had, that if there was any funding for gun violence research, they were in danger of closing down the National Center for Injury Prevention. So what funding we've had for research has been small and has come primarily from private foundations, Wellness and the Endowment, the Burnett Foundation, and Soros, and a couple of other places. But so what we know is a bit jaded by what we don't know. So just to start with that. So this is a very busy slide, but it's to tell you that violence is a global public health issue. And more than 1.6 million people worldwide are affected by it. But it affects people across the globe in the same way it affects people here in Los Angeles. So it affects public health in many ways. It brings on a major change of physical and emotional problems, reproductive health, mental health problems, as we know, and it costs billions of dollars. But what's different about the global problem and our problem here in the United States really is the firearm. So the U.S. is an example of this is what I'm talking about. Our crime rates for burglaries, crimes, thefts, suicides are not very different from other countries, but our rate of gun violence and gun homicides are very, very different. As you can see here, our rate is 4 times higher than Switzerland and Turkey, 15 times higher than Austria, the Czech Republic, Spain, and New Zealand, and 30 times higher than the UK, Poland, Australia, France, Hungary, Israel, and Slovenia. Keep in mind that these are rates, so their population is taken into consideration. So the number of gun deaths in the U.S., as Dan has said, we have about 30,000 gun deaths annually and an additional 70,000 victims that survive. More than 50% of the gun deaths in the United States are suicides, and people tend to forget that when they talk about this as a crime issue and an issue of illegal guns. Guns are being used in many, many ways. And we've been hearing a lot lately about how much better we're doing, that crime rates are down, homicides are down, but the facts tell us another story. Most of the reported success is reported using law enforcement reporting on their own data. Law enforcement doesn't count suicides unless there's a crime involved, and they don't count injuries in people who wind up hospitalized and disabled for the rest of their lives. So about 20 years ago, we had about 50,000 gun deaths a year and about another 50,000 injuries. So now we have, as you can see, about 100,000 gun injuries a year. So gun injuries and gun violence in this country has not really changed. It hasn't increased or decreased, it stayed the same. Keep in mind that had Gabby Giffords been shot in the head 10 or 15 years ago, she would not have survived. So we've gotten better at saving people, but we really haven't gotten better at stopping the shooting that's going on.